Hey golfers, this is Dr. Paul Hendricks at the Golf Performance Academy here inside of Body Balance Physical Therapy. And so one of the things we're getting a lot of calls about as the weather's starting to get nice again, everybody's getting back out on the courses. A lot of people are complaining about some shoulder issues that are going on. So I wanted to kind of come back today a little bit, show you about a little of the anatomy about the shoulder and talk to you about some of the common causes that we see in shoulders with our golfers. And then I'll show you a quick assessment that we can do as well. So as many people know, probably lower back pain is probably the #1 reason that amateur golfers come in injured. Shoulders is probably the second most common thing we see in golfers, especially people who in their trail side shoulder. So if you're a right-handed golfer, it's going to be your right side. And let's just talk a little bit about why. So here's my little friend, the shoulder. And so the shoulder is kind of made up of your rotator cuff muscles. Most of us know about rotator cuff tears that happen in there. They're actually a little bit less common in your golfer than you would think of. One of the most common things we see is what we actually call a shoulder impingement. And so a lot of times that has to do with muscles that are a little bit weak on the back of our shoulders, causes our shoulders to kind of come forward in our posture. And again, with a lot of our technology stuff that we're doing today, working at the computers, working on our phones and stuff like that, posture kind of has a tendency to kind of get a little bit round. And one of the things I commonly see is when somebody is standing, if somebody's standing with a rounded forward shoulder posture, as soon as they go into their address posture, they're going to come down into that rounded shoulder, okay? And so what that does is the big bone in our arm kind of slides forward in the shoulder, and when we come through into that shot, that shoulder slides forward, it can actually get a pinch between the two bones, and that's typically what we'll get. So you'll get people call it an impingement. Sometimes it's even known as kind of a shoulder tendonitis. Those are things that we really want to try to take care of sooner than later, because the unfortunate thing is if you let something like that go, those can turn into a bigger rotator cuff tear, because what happens is that little tendon kind of gets picked away out a little bit at a time, and eventually that tendon can completely tear. And so the best thing to do is let's stop it while it's early, strengthen the muscles in the shoulders that are weak, stretch the muscles that may be short in the front, and let's take care of that shoulder issue sooner than later. So if you have any questions, comment down below. If you know anybody who's also a golfer, somebody who's in your foursome who maybe has some shoulder pain, share this video out with them. And stay tuned, because we're going to have another video that's going to talk about how to be able to test your shoulder for that strength, for that impingement issue that you may have. And then if you really stay tuned, we may even show you a quick little video on some exercises that you can do to fix that as well. So until next time, keep it in the short grass.